It blows my mind sometimes when patients come in and they tell me that someone out there told them that they're not a candidate for dental implants. It blows my mind because that's simply not true. Dentistry has progressed to a point today where no matter what shape or form your jawbone comes in, we can make it work. The difference maker in these situations is your dentist and the level of experience and training that they've had. Here's a specific case that highlights exactly what I'm talking about right now. The case that I'm talking about relates to a person that came to my office telling me that they've been to multiple practices and they'd been told that they're not candidates for dental implants. And honestly, she came into my practice pretty skeptical, and I don't blame her. Now, this case in particular was difficult because the patient indeed did have insufficient bone, and it wasn't easy to find places for us to place those implants. But we were able to make it work. You can see here that these implants were planned ahead of time. And what I'm about to show you is where the implants actually landed when we finished her surgery. Every implant was placed exactly where we had planned ahead of time. You can see here that she was missing a significant number of teeth. And if we remove her photo, you can see here that the patient had teeth that were not in the correct position. They were too short, and what's even worse is that they were loose. So what we were able to do is overlay the patient's smile on these teeth and determine exactly where we need to put the new set of teeth in order to fix not just the way the patient's smile looked, but also the way her teeth functioned. And this is the plan that we came up with. In this scenario, we were able to get teeth exactly where we know is an ideal situation for people. When you smile, you want to see that fullness. Having said all this, although aesthetics are fantastic, the most important aspect to me is how these teeth are going to come together to help you chew food and keep your jaw healthy. And we're able to accommodate this as well. If I were to remove the patient's face photo from this, you can see that we have full control over where we put your back teeth as well, so that when you go to chew with these teeth, you're not being left with an open bite, a cross bite. Frankly, you're not being left out to dry with teeth that don't chew. One of the main issues that we see on cases that we have to revise are TMJ issues. If you're experiencing headaches or chapped lips after having received your teeth, please come see us, because these are things that we can fix simply by readjusting the length of your teeth, their width, and their relationship to one another. You have absolutely nothing to lose. We offer complimentary consultations, so come visit us at Orcutt Hills Dental Studio. We look forward to seeing you soon.